I came to Calgary in 1973, and at that point, neurosurgery was part of the Department of Surgery, and neurology was part of the Department of Medicine. And so I worked with Drs. LeBlanc and Taylor in private practice. Then Dr. LeBlanc moved to the university, and Dr. Taylor and I continued on. When the department was formed, it was a time of sort of a good news, bad news from my point of view. Because I did pediatrics, I was actually very happy. The children were all cared for on the 11th floor of Foothills Hospital at that point. And the Children's Hospital over on Richmond Road was being essentially rebuilt as a tertiary care center. But there were no plans to have an emergency room initially, and there were no plans to have acute care there as such. And so when suddenly the decision was made that they were going to have all kids there and children were going to be moved out of Foothills, that made things a bit dicey because we had no support over there. And my colleagues in the neurosciences were actually quite happy with that decision because they had their eye on the 11th floor, which subsequently became neurosciences. The formation of the department, I think, allowed us to really consolidate and expand, start programs, which we didn't really have prior to that time. Bob Lee provided great leadership and recruited a lot of very good people. And so programs began to develop, and with them actually funding for positions. And so again, the number of full-time faculty, people with full-time university appointments, really took off at that point. Initially, we had no residents here. When I first came, we had a resident who came from Edmonton for 6 months, and we relied very heavily on nurses, especially nurses who had taken the postgraduate training course. That was something that was set up by Dr. LeBlanc and run by Doris Green, and we all contributed to that. We relied very heavily on the nursing staff before the residency program was developed. And the neuroscience nursing program there was one in Montreal, and so it was felt that it would be very helpful to have a similar program here. So it was the only program in Western Canada and attracted nurses from all across Western Canada while it was running. And a number of the graduates of that program stayed on at Foothills and really provided excellent patient care. I initially got into a leadership role at the Children's Hospital because I wasn't happy with the way things were developing there. And the position as the Chief of Staff Surgical was actually created. And so I applied and got the job. I spent a lot of time trying to recruit good people and develop a critical mass of specialists devoted to the Children's Hospital. I think that's the important thing, is to have a critical mass of good people and to only recruit people that you're very comfortable with, that you know are going to work hard, do excellent clinical care, but also pursue academic interests. Members of the department have been involved in undergraduate teaching since the beginning of the medical school and been involved in curriculum development. I think we have all contributed as much as possible. Dr. Charles Taylor was a great teacher and encouraged others to teach. We have been very fortunate in that some of the medical students coming through the university have been inspired, shall I say, to pursue studies in the nervous system. I'm very pleased when you see somebody who's decided that they like the nervous system and gone on to do more training. It's always very rewarding to see that. I spent 10 years as the director of the residency training program. When it came to recruiting residents, we tried very hard to select residents with whom we were going to be very comfortable working. It's almost like taking somebody into your family to be working with them 8 hours a day, 5 or 6 days a week. And they're all bright young people. And so we ended up essentially picking residents with whom we were going to be comfortable, and residents who had a good appreciation of what they were getting into. Technological advances have been phenomenal in neurosciences. When I first came here, we did not have a CT scanner, for instance. It was only in 1975 that we got a CT scanner. Prior to that time, we relied on pneumoencephalography or ventriculography, which was very invasive. We did myelograms, which involved a lumbar puncture and injecting contrast into the spine. So our diagnostic tests were very invasive and very uncomfortable for patients. You thought long and hard before subjecting a patient to a pneumoencephalogram or an invasive test. Changes in the operating room as well. Anesthetics have improved. Monitoring of patients intraoperatively has improved dramatically, so that patient safety is much better. Image guidance systems in the operating room, that's made a huge difference as well, allowing us to accurately localize lesions in the operating room. And then the intraoperative MRI as well. So those advances have really been tremendous. They have improved our ability to carry out complex surgical procedures, and they've also made it much easier for the patients and safer. The support services, radiology, the development there in neuroradiology has been tremendous.